Now it's time for TIPisodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale, oh yeah, A Tale of Two Hygienists.
Hello everyone, I'm Crystal Barnes, and I've been a hygienist for nearly a decade after starting my career as a surgical assistant in a periodontal office for several years. I also work as the dental hygiene advisor for Ultradent. As a dental hygienist, my patients trust me not only to provide the best care possible, but also to keep them informed about the procedures they undergo. One of the hardest parts about my profession is trying to educate patients on periodontal disease as well as the preventative benefits of fluoride varnish. It's often easy for us as clinicians to brush off the deep cleaning conversation when we are trying to squeeze everything into a 1-hour appointment, especially when we are on the fence about a couple of localized 5mm pockets with bleeding that we know we can get them cleaned and out the door in hopes that the patient will show improvement at their follow-up cleaning. I'm typically quite aggressive when it comes to diagnosing periodontal disease, and it can be mentally exhausting. Plus, it's time-consuming, and patients don't like to hear that there are issues in their gums, that they might need to get numb, and that the insurance may only cover a portion of this procedure. Once we poured our blood, sweat, and tears into educating them on their current periodontal status, we now have 20 minutes left, still needing an exam, and at times a frustrated patient who didn't even get what they came in for. We've heard it all before. They just want a regular cleaning and to be in and out within an hour. While sitting in the dental chair may not be the favorite part of a patient's day, some treatments like scaling and root planing or a fluoride varnish application may seem particularly daunting to them. Here's how I approach these conversations to alleviate concerns and promote oral health. When it comes to scaling and root planing, I like to start by educating on the why behind the procedure, discuss the benefits, such as preventing gum disease and tooth loss, and how it can improve overall health. This procedure takes time. There are harmful pathogens present, and rushing through this would be doing a disservice to them and to ourselves as clinicians. We may incorporate some laser therapy to reduce harmful bacteria deep inside the pocket. We need extra time to thoroughly disrupt the pathogenic bacteria and promote healing. Being empathetic is very valuable during these chats. Acknowledge that the patient may have apprehensions. Let them know that it's normal to feel anxious and that their comfort is your priority. Do you have any visual aids around the office? Use them. Show patients diagrams or models of what plaque and calculus buildup look like, how it affects bone loss, and how a thorough scaling and root planing addresses these issues. I love giving them a visual and showing them their probe chart depths, their bleeding, and the radiographs, especially when there's radiographic calculus that they can see. Break down the process. Explain the steps involved in the procedure. Understanding what to expect can reduce anxiety. I also try to incorporate personal stories to help reassure my patients. Sharing positive outcomes from other patients who had similar treatments can help put their mind at ease. In addition, that we are a team and that I am a resource for them and we will make adjustments along the way to their treatment plan and home care as needed. Finally, and possibly most importantly, highlighting the pain management options can help with stress. Many patients are averse to deep cleanings purely because they fear the potential pain. Discuss local anesthetics and sedation options available to manage discomfort during the procedure. Nitrous is our friend. Universal dentin sealant is a great option to help reduce root sensitivity before or after scaling and root planing, and it only takes a few seconds to apply. Now, let's switch gears. Discussing fluoride varnish applications can be easier because there likely isn't a fear of pain, but talking about these treatments has its own set of difficulties. I like to start by emphasizing protection. Explain how fluoride varnish can protect teeth from decay. It neutralizes the acids in our mouth and promotes remineralization, making them stronger and less susceptible to cavities, and how this could potentially mean less time in the dental chair for procedures they aren't a fan of in the future. Inform them that the application process is quick and painless, typically taking only a few minutes. Also, describe the aftercare. Provide clear aftercare instructions and reassure them that they can return to most of their usual activities immediately. Some people may just not like the taste or the texture of fluoride varnish. In these cases, you can choose a pleasant option like Enamelast from Ultradent. It's available in Walterberry, orange cream, cool mint, bubblegum, caramel flavors, and flavor-free. And in my office, flavor-free has been a huge hit. I like to tell my patients it can be any flavor they choose because it's slightly sweet, but it doesn't really taste like anything. My personal favorite is Walterberry. It's also important to address misconceptions. Some patients shut down when they hear the word fluoride. Clarify any myths or misconceptions about fluoride treatment and use evidence-based information. Personalizing the benefits of fluoride varnish treatments can also help break down barriers patients may have. Tailor the conversation to how fluoride can specifically benefit their dental health given their lifestyle and dental history. Talking to patients about procedures they're not excited about requires a blend of empathy, education, and reassurance. As dental professionals, we must remember that our approach can turn a daunting experience into a positive step towards a better oral health. By implementing these tips, you can help patients feel more at ease and willing to undergo necessary treatments for their dental well-being.
A tale of two hygienists.